Hey, how you doing? This is Adam Post, publisher of more than 1,000 comic books and marketing expert covering Walgreens. Woke panic as Walgreens closes stores permanently. Let's get into the story. Before we do, please be sure you are subscribed to the channel. Click the bell for notifications. I really appreciate you guys. Coming from the Daily Mail, Woke Squad member Ayanna Pressley claims Walgreens is racist for closing stores in crime-ridden areas because it is a disruptive, life-threatening act of racial and economic discrimination. From the New York Post, far-left rep Ayanna Pressley accuses Walgreens of racism over Boston store closure. And from Forbes, here's why drugstores are closing in minority neighborhoods. Walgreens, CVS, and Rite Aid shutter more than 1,000 stores. From the Daily Mail, Woke Squad member is very upset. The issue is this, and it's a big, serious problem. When people's actual lives are affected, they start to not like their politicians so much. Ayanna Pressley is a Democrat, so she needs to make as much noise as possible and attack these companies to say, hey, look, you can't just close these stores because they're being completely robbed blind. You got to keep these stores open, let people shoplift, let people steal. It's not the fault of the individuals, it's the fault of the system. You're a multi-billion-dollar company. Why can't you just subsidize these stores? But at some point, the stores have to say, look, we are a public company. We operate an actual business. We're not just here to provide free stuff for people to shoplift. That's the conflict. Voters that live in these cities want to have pharmacies, though. There are some people that actually vote. They try to live relatively normal lives. They need to have access to pharmacies. They need to have access to supermarkets. They want these businesses to continue to operate. Those are the people that are going to the representatives like Ayanna Pressley saying, hey, it's great that you want to have social justice and all that, but if we're going to continue to vote for you, you've got to improve our lives or at least let us maintain our lives. And that's not happening because of all the theft and destruction of cities and normal qualities of life. Democratic Rep Ayanna Pressley has condemned Walgreens for racial and economic discrimination after closing a pharmacy in Boston. Pressley, a member of the ultra-progressive squad, said the chain was abandoning low-income communities with the most recent closing in Roxbury on Wednesday. Walgreens announced the closure of several stores nationwide due to what the company has described as rampant theft in some areas. Pressley said this decision targets areas with significant minority populations, calling for the company to reconsider their decision instead. I mean, what are you supposed to do if you're operating a company? We apologize if the skin color or the race or the sexual preference of the people who robbed the stores blind happen to be your constituents, happen to be the people putting you in power, but they need to operate their business. It can't continue if the people who go in there rip off the stores nonstop. In a speech addressing the House, she said this closure is part of a larger trend of abandoning low-income communities like the previous closures in Mattapan and Hyde Park, both in the Massachusetts 7th District. When a Walgreens leaves a neighborhood, they disrupt the entire community and they take with them baby formula, diapers, asthma inhalers, life-saving medications, and of course, jobs. These closures are not arbitrary and they are not innocent. They are life-threatening acts of racial and economic discrimination. That's why I joined with Senators Markey and Warren to demand answers from Walgreens CEO. But why was there no community input? The community input was when you guys shoplifted the place literally out of business. That's the community input. No adequate notice to customers? And no transition resources to prevent gaps in healthcare? Shame on you, Walgreens. Okay, but are you speaking to the people who actually run the cities, who make it possible for criminals to wipe out these businesses and make it impossible for them to operate? While there are plenty of neighborhoods still left in America so far that don't have rampant shoplifting, that don't have rampant violence, that make it possible for national businesses to continue to operate, how long are they supposed to subsidize neighborhoods that have this nonstop stealing? It's great to see pushback from companies. Maybe that will make them change their policies. Quote, having a website with talking points about health equity and underserved communities is not enough. Walgreens is a multi-billion-dollar corporation that needs to put their money where their mouth is and stop divesting from Black and brown communities. It's not just Black and brown communities, it's whatever the theft rate is. You can't say just because we have a certain skin color, We're allowed to continue to do what we're doing, and you need to continue to operate here, even if it's at a loss. There is an obligation to shareholders to operate on a profitable level. Businesses are not entitled to make donations to neighborhoods. They can make some donations, but it can't be this open-ended, unlimited, steal whatever you want from our store kind of operation. The next problem the stores would have is, hey, you're not restocking enough stuff that we want to steal. Walgreens, which has been one of the chains hit hardest by retail theft, announced its intentions to close roughly 200 stores across the nation last year. The Walgreens that Pressley had been referring to was the fourth one in Boston to close in a little over a year, according to Boston 25 News. In order to help ease the transition, Walgreens said they would automatically transfer patient files and prescription files to a Walgreens 1 mile away. Now, a mile is not actually that far. I can walk a mile. It doesn't take that long. It's not super convenient, but if stores are going to get robbed out of existence, yeah, you're going to have to walk an extra mile. The company said changing factors, including the dynamics of the local market and a change in buying habits, are factors taken into account when closing a branch. We all know it's theft. They don't want to come out and say, look, it's ridiculous, rampant theft. You need to speak to your constituents and tell them to stop robbing us blind. But that's really what's going on. Opponents of the closure tried for weeks to convince the company to reconsider its decision, but were unsuccessful, and the location closed on Wednesday. The pharmacy chain has had to close stores across the country with an emphasis specifically on the city of San Francisco as it grapples with high crime. Last July, footage emerged of a Walgreens that had to resort to chaining freezers shut to stop shoplifters. Video shot by one potential shopper at a local Walgreens in the city sees aisle after aisle of products locked away behind perspex and glass out of the reach of thieves. At one particular location, the freezer doors are entirely chained up, with staff concerned thieves will come into the store overnight to empty the contents. The problem of such wanton theft is not unique to San Francisco. Other big cities across the nation, including in New York, have also been dealing with the problem over the last few years. In some cases, it has left pharmacy chains like Walgreens no option but to leave areas completely, as massive thefts hurt the bottom line. Ayanna Pressley, Alexandria Ocasio-Cortez, Ilhan Omar, Rashida Tlaib are frequent targets of Republicans who claim they are trying to stoke racial divides by highlighting differences between white people and minority communities. In August of last year, Pressley made headlines after Vivek Ramaswamy accused her and an anti-racist author as being part of the modern KKK. Pressley hit back at Vivek, saying he had verbally assaulted her over his remarks. From Forbes, here's why drugstores are closing in minority neighborhoods. Walgreens, CVS, and Rite Aid shutter more than 1,000 stores. A spate of pharmacy closings in Boston have drawn protests as more than 1,000 drugstore chain locations across the country have closed, reigniting long-standing concerns that low-income Black and Latino Americans are bearing the brunt as pharmacies continue to disappear amid increased competition and other factors like theft. Don't steal from your local pharmacy. Steal from other places. Pharmacies are important. That's where people get their medications. You're really killing your community if you're going to rob from a local drugstore. Rite Aid, Walgreens, and CVS over the last 2 years said they'll close as many as 1,500 stores, and experts say minority communities will likely be the first to lose pharmacy access. The large chains have struggled in recent years. Rite Aid filed for bankruptcy in October. Walgreens stock plunged after the company cut its quarterly dividend, and CVS has cut more than 1,100 stores since 2018 amid greater competition from Amazon and Walmart and staffing shortages, according to the Washington Post. Thousands of independent pharmacies have also been forced out of the market in the last decade. Independent pharmacy is just someone opening their own small business as a pharmacy. There are plenty of independent phaRmacies, but of course, the reason you don't see independent pharmacies running into that Boston market where they're being robbed blind is because they're not a multi-billion-dollar company that could subsidize the losses of theft. That's the bottom line. You've got to get real with people or nothing's ever going to get done. Research conducted in 2022 by Cornell and Yale University scientists found that 670 pharmacy deserts in New York City, Los Angeles, Chicago, and Houston, all but 3 were found in predominantly minority neighborhoods. Quote, in Chicago, almost a third to a quarter of the population lives in a pharmacy desert. And if you look at people who live in predominantly black neighborhoods, that's more than half of the people living in those neighborhoods. Walgreens postponed the closure of a location in the city's Roxbury neighborhood, where black and Latino residents make up 85% of the population, until January 31st, following protests from residents. The closure comes months after the company closed stores in Mattapan, Hyde Park, and Lower Roxbury, also majority non-white neighborhoods. There are 18 Walgreens stores in Boston, according to the Globe, but only those in minority neighborhoods have closed in the last few years. It's nothing against minorities, it's just if these stores are not profitable, they're going to close, whether it's because of theft or any other reason. Maybe it's because of competition. In this case, though, it's obviously because of theft. So it's important to talk to people who run these neighborhoods to say, look, you can't allow this theft to go on. Enough with the prosecutors who won't prosecute people or whatever it is that's causing this excessive theft. It needs to stop. In the last few years, all the country's major pharmacy chains have announced store closures. CVS will complete the closure of 1,124 stores by the end of this year. Walgreens in June said it would close 450 of its locations across the country by August. And Rite Aid's bankruptcy filing came with announcements of almost 200 store closures. Rite Aid said the stores that were closing are those that have underperformed, and Walgreens said in a statement to Forbes that factors like existing footprint of stores, dynamics of the local market, and changes in the buying habits of our patients and customers are why some locations close. These locations are actually very expensive to set up. It's not like they flip a switch and all of a sudden, hey, there's a Walgreens store. It's completely stocked. It's totally managed. There are employees there. It's very expensive for the company to set up a location. They do it in hopes of making a profit. If they can't make a profit and they don't see a future in being able to make a profit, they have to close the store. It's a massive loss to a company to have to close a store. It's the last thing they want to do, and they'll only do it if they're forced to close it because the store has no future of being profitable. It's not just about being profitable today. It's about being profitable in the future. And the ones that close don't look like they're ever going to be profitable. CVS, which plans to close 300 stores this year, similarly said in a statement locations are chosen based on local market dynamics, population shifts, a community store density, and other geographic access points to meet the needs of the community. In some cases, rampant theft has been blamed for store closures. In October 2021, Walgreens announced it would close 5 San Francisco stores, including one in the historically Latino Mission District. But Walgreens' chief financial officer last January admitted that the company exaggerated the claims of retail theft when it relied on the excuse to close the San Francisco stores. Everyone knows San Francisco is a complete disaster. They're saying that to help out the politicians and because the politicians didn't like the backlash. These claims fueled right-wing anger over a rise in crime before Kehoe said on an earnings call that the company maybe cried too much about retail shrinkage. When you're getting wiped out and the local community says it's impossible to prosecute people robbing the stores, this is what happens. Jenny Guadamus, a researcher at the University of California at Berkeley, said the stores that close are almost always in Black or Latino communities because minority communities are more likely to have residents on public health care programs like Medicaid, which sees a lower medication reimbursement rate than many private insurers. It's likely true those stores are often a cost burden when compared to others, Guadamus said. But what they care about is maximizing profits for their shareholders, she said. They'll make any excuse to close lower profit margin stores, which are in these Black and Latino communities. That's a ridiculous statement. These stores will continue to operate if they can make any kind of profit whatsoever because of the cost of closing a business. If you've ever had a business and had to let people go, or you've ever had a business and hired people, it's expensive. It's not free to hire people. You have people you put on the payroll, you train them, they work for a few weeks, you pay their payroll, you're distracted by bringing those people on. This is literally any business. It's not just a pharmacy or a manufacturing business. It's expensive to locate people, pay them, try to train them. It's a distraction. It takes you away from doing other things. It's an investment. If these stores could break even or just lose a little bit of money, Walgreens, CVS, Rite Aid, they'd be happy to keep these stores. They also don't need the political blowback. And of course there's blowback. The reason the stores close is because they're not profitable to operate, not because of Medicaid, but because of rampant theft. Rite Aid in late 2022 debuted the first of its small format stores it said exists to combat pharmacy deserts in communities. The chain has operated several stores so far, which take up about 3,000 square feet instead of the usual 11,000 to 15,000 square feet in rural Virginia. Quote, they are strategically placed in areas that don't have nearby access to pharmacy-related healthcare services, Rite Aid said in a statement to Forbes. A study in the Journal of the Academic Medical Association showed that those without easy access to pharmacies are more likely to fall behind on taking medications and see more medical problems than they likely would have with equitable access. Well, of course, if you don't have a pharmacy near to you and it's a big deal to get your medications, it's likely that you're less likely to get those medicines and take them. And of course, the medicines are supposed to have, and of course, those medications are supposed to have a positive effect on your health. Those without access to medications join the estimated 9 million Americans who aren't taking their prescription drugs as prescribed for a number of reasons, including a lack of health insurance and overall cost of medicine. Non-adherence to recommended medication schedules is estimated to cost the United States between $100 billion and $290 billion per year. Let me know what you think of all this in the comments below. Always love to see your ideas. Please be sure you are subscribed to the channel. Click the bell for notifications. Give me a thumbs up, and I'll see you again soon with another video. And if I don't see you, I will miss you.